Hi, I'm Kelsey Canelin, and today we're going to talk about post-traumatic stress disorder, or PTSD. So what is PTSD? It is a mental health disorder diagnosis, which means it's a medical condition and it must be diagnosed by a psychiatrist or psychologist. It develops in individuals who have experienced a frightening or dangerous event, and there is such thing as chronic and acute PTSD. Chronic PTSD occurs in the event that the trauma involved has long-term effects, and those effects can be psychological or physical. And acute PTSD is categorized by short-term, immediate effects of trauma. Um, there is a difference between rational fears and the altered brain function of PTSD. Another way to think about it is the natural or normal versus the unnatural or abnormal reactions following trauma. This blue ribbon here is the awareness ribbon of PTSD. The month of PTSD awareness is June. So PTSD and the brain. So here we have a picture of the healthy brain versus the brain of a patient with post-traumatic stress disorder. Red here, this is signifying cortisol. Cortisol is the stress hormone, and you can see in the healthy brain, it's really centralized in just one area of the brain. It's not very much. Versus the PTSD patient, you can see that this stress hormone is everywhere. There's a lot more of it, and it's in multiple areas of the brain. So another way that the brain changes with post-traumatic stress disorder is through the thought processing and also the emotional memory processing that can occur with any actions of life. It basically gets shifted in patients with post-traumatic stress disorder in three different ways. So the first way involves the prefrontal cortex. That is this part of the brain, and this is if this person's head has the eyes here, the nose here, and the mouth here. So they're facing that direction. So again, this is the prefrontal cortex. In a PTSD patient, that area of the brain shrinks. And this region regulates negative emotions that occur with external stimuli. So basically that is how we absorb experiences. And then two other ways that the brain changes from PTSD. First one involves the amygdala. The amygdala is really, really little, but it's an important part of the brain. It helps process emotions, and it's linked to fear responses. The amygdala increases in activity in PTSD patients. And then lastly, the hippocampus, which is attached to the amygdala, shrinks. And this area helps distinguish between past and present memories. You can think of this area of the brain as like a filing cabinet, and this is how we file all of our memories. So if that filing cabinet is shrunk, then memories will be altered. So again, just to reiterate, an individual with PTSD takes in information, processes information, and stores information differently than a healthy individual, not just because of an emotional reaction, but because their brain has physiologically changed. So some signs and symptoms. To be diagnosed with PTSD, an adult must have 1 to 2 symptoms from 4 different categories, and these symptoms must occur for at least 1 month before diagnosis. So the first symptom category is re-experiencing. The patient must have at least one of these symptoms: flashbacks or reliving the trauma, bad dreams, and fear-inducing thoughts. And the next category, again, the patient must have at least one of these symptoms: staying away from places, events, or objects that are reminders of the trauma, and avoiding thoughts or feelings related to the event. Arousal and reactivity, that is the third symptom category, and the patient must have at least 2 of these symptoms in order to have diagnosis. First is being easily startled, feeling tense or on edge, and the biggest one, having difficulty sleeping, eating, or concentrating. And then the last symptom category has to do with cognition and mood. And again, the patient must have at least 2 of these symptoms: trouble remembering key features of the event, negative thoughts about self or of the world, feeling guilt or shame, and loss of interest in enjoyable activities. So again, the adult must have one symptom from the first two categories and then two symptoms of the last two categories in order to be diagnosed with PTSD. So children 6 years of age or younger experience different symptoms. For example, wetting the bed after being toilet trained, forgetting how to talk or being physically unable to speak, acting out the trauma during playtime. So as an example, if a child were to be kind of play fighting with another kid, that may be a sign of post-traumatic stress disorder. And then lastly, being unusually attached or clingy with a parent or other close adult. Some more symptoms, and this is specific to teenagers. So teens are similar to adults in that they must experience the same four categorical symptoms as adults, but they also may feel guilt. They may have thoughts of revenge, and that is specific to teens. And they also may demonstrate some behavioral problems, so disruptive, disrespectful, or destructive behaviors, either to themselves, to another human, or to an object. So this here is Lady Gaga. Lady Gaga is a famous musical artist. She recently admitted to having PTSD as a teen following sexual assault as a teenager. So there are some risk factors that make someone more susceptible to PTSD: dangerous events, mental illness, witnessing trauma, and then what happens after a traumatic event. So some dangerous events that are risk factors are getting hurt. So being in a car accident, also physical and sexual assault, and then military experience as well, so war experience. Mental illness makes somebody more susceptible to PTSD, specifically if they suffer from substance abuse. Also, having a mental illness may make somebody unable to recover following a trauma. So, as an example, someone with anxiety or depression, those mental illnesses may affect the steps that that person takes following a traumatic experience. Witnessing trauma is also a big risk factor. Seeing mass shootings, which unfortunately is more and more prevalent in American society, that is a big one for PTSD. Also, if a person's loved one experiences trauma, that person may also develop their own PTSD. And then lastly, seeing a dead body is a traumatic experience, and that's why so many first responders and military service men and women are highly susceptible to PTSD. After a traumatic event, if the person receives little or no support, or if they are high stress after a traumatic event, so as an example, losing a job and then having to deal with uprooting a family, that is extremely traumatic, and that can make somebody more susceptible to PTSD. Continuing on here, not everyone who experiences trauma develops PTSD, and not everyone who has PTSD has experienced trauma. PTSD can be caused by many factors and not necessarily traumatic experiences. So this is the risk rate for those that have experienced traumas. So, of those that experience the following traumas, you can see down here, this is the percentage of survivors that are likely to develop post-traumatic stress disorder. So, as an example, if you look far left, the rape victims, rape survivors, you can see about 50% of rape survivors are likely to develop PTSD. Also, serious accident or injury, so people who are in a car accident have about 17% chance of developing post-traumatic stress disorder. And then kind of low here is natural disasters. So if you think about hurricanes, about 5% of natural disaster survivors are likely to develop post-traumatic stress disorder. So if we talk about risk reduction, there are ways and things you can do before and after traumatic experiences to decrease the likelihood of post-traumatic stress disorder development. So before a trauma, it's important to be confident in one's ability in the face of danger, and a way to achieve that is by taking self-defense classes. It's also important that a person is able to act and respond effectively despite feeling fear. So, as an example, if you are out in the middle of the night walking your dog and you see a gentleman, a hooded figure, come over, and you feel that fear, it's important that you are still able to remain calm so you can defend yourself if need be, as opposed to not be numb and be so stricken by the fear that you can't react effectively. After trauma, you can demonstrate some positive coping strategies with therapeutic techniques or other treatments, which we'll discuss later. And then also find support. So, whether it's a therapy group or family and friends lending their support, that is a way to reduce your risk of developing post traumatic stress disorder. And then the most important way to reduce your risk of developing post traumatic stress is to talk about it. By speaking up, not only can we remove the stigma surrounding mental health, but a person is able to heal if they can share their story openly and when it's received in love and acceptance. Therapy. So therapy is really common. The purpose of therapy is to teach coping skills, help with emotion identification, so figuring out what it is exactly that you are feeling, and then learning about the trauma and the way that the brain can reprocess the memory. There are many types of therapeutic techniques. Exposure therapy and cognitive reconstruction are popular kind of categories. And then specific techniques that are commonly used are cognitive behavioral therapy, or CBT, and that changes the way that you think about yourself and the way that you formulate your thoughts. And then another one is EMDR, or eye movement desensitization and reprocessing. This is a technique that uses eye movements to alleviate distress surrounding traumatic memories. It's may or may not be used coincided with medication. The purpose of medication is to control the symptoms that somebody with PTSD may be feeling. So, as an example, a common medication is antidepressants that can help control some symptoms such as sadness, fear, anger, anxiety, and numbness. So my story. This is me in 2012, and I this year was raped while I was attending college in Los Angeles. I am a survivor of sexual assault, and it took 5 years for me to be diagnosed with PTSD and anxiety. Although it did take 5 years, I am now getting the help that I need. I am currently in the process of EMDR treatment, and I think it's working great. And an important thing to note too is that I'm not just my PTSD diagnosis. Sometimes people think people with PTSD are this, one type of person, maybe this one military member who kind of loses their mind a little bit. No, not at all. I am a walking example of a post-traumatic stress disorder individual. I do have really difficult, debilitating moments that sometimes last days at a time. In fact, this semester in particular, I had a very hard time and my grades suffered significantly. But that being said, I also work over 50 hours a week like any other functioning adult. I'm working towards my degree and bettering my life, and I'm also getting married soon, so I'm now able to have healthy relationships. Basically, the point of that is to discuss that recovery is possible. I hope I helped enlighten you about a common mental health condition. PTSD affects 5.2 million Americans, or about 8% of American adults. So keep the conversations going, and thank you for listening.